Good evening. I'd like to call the regular Board of Commissioners meeting to order on November the 3rd, 2014 at 7 o'clock. I'd like to welcome everyone here, especially our media. And at this time, I'll ask Commissioner McIntyre for invocation.
Let us pray. Dear Heavenly Father, we thank you for another beautiful day. We thank you for the many blessings that we have shared. We ask now that you be with us and bless this meeting so that we make wise decisions that will be for the betterment of our people and pleasing to you. These things we ask in Christ's name. Amen. Please stand join me in the pledge.
As far as I know, there's no changes to the agenda, and I will entertain a motion to accept the agenda as presented.
So moved.
Motion made by Commissioner McIntyre, seconded by Vice Chairman Donovan. All in favor say aye. Motion carried. First item is Transportation Service Fiscal Year 2015-16 Commuter Transportation Program application. Gwen?
Good evening. I'm here to present the 2015-2016 Community Transportation Program application. This application is for the administrative and the capital funds for the Transportation Department. For the administrative funds, we're requesting $226,600. That requires a 15% local match, which is estimated at $33,901. The capital funds this year, we're requesting approximately $67,199. That's a 10% local match, estimated at $6,720. That includes replacement of one vehicle, the lettering for that vehicle, replacement of 5 computers, 1 desk chair, and 2 transmissions for the light transit vehicles that we have. The total estimated local match, depending on how much DOT will approve of this budget, is $40,621. And I'll be glad to answer any questions.
Anyone have any questions, Gwen? If not, I will declare the public hearing open at this time. Anyone like to speak for or against, come forward at this time. Seeing none, I declare the public hearing closed. What's the pleasure of the board? Motion made by Vice Chairman Donovan for approval, seconded by Commissioner McIntyre. All in favor say aye. Aye. Motion carried. Next item is Planning and Zoning. Presenter is Michael Sandy, Planning Director. Good evening.
Thank you, Mr. Chairman, Board of Commissioners, County Manager. Before you tonight, we've got a couple cases. Get this thing going here. All right. First item this evening is Zoning Amendment 14-04. Mr. Willie Lawhon Jr. Requests a rezoning from R20 single-family residential to GB general business. Applicant requests to rezone a .79 acre parcel of land from R20 to GB, record number 7158. Property is located on the east side of 2427 Highway, approximately 150 feet north of its intersection of Converse Road. The purpose of this request is to use the property for commercial use. The immediate neighboring properties are zoned R20, and outlying areas surrounding that are zoned RA. Property is served by county water, but the public sewer is not available. Property is not located in a regulated floodplain, and is not located in a water supply watershed. Traffic is estimated on this section of 2427 is approximately 13,000 cars per day, as studied by NCDOT in 2013. Planning Board looked at this case last month and forwarded a favorable recommendation due to the fact the property is located in the county growth area according to the Stanley County Land Use Plan. Be glad to answer any questions.
Anyone have any questions of Michael?
Mr. Chairman, I have one question. The notes from the Planning Board meeting indicated that we don't know yet whether the septic tank is acceptable to be used. Have you got that information yet?
We've gone through the project review committee with Mr. Longhorn and made him aware that there is an existing septic tank on the property, as you saw in the notes. And that's from the house that was there before the road widening. And he has not spent any more money on this case until the zoning goes through to evaluate that septic tank. But he would still have to find out what's the extent of that septic tank in its capacity.
So we're gonna wait until we rezone to know whether the existing septic tank can be used? Is that what you just told me?
Yes.
And if it cannot be used, then what will happen?
He will have to put another system in. They would
Okay,
just have to go out and evaluate it.
Is there space on that property to do that?
For the use that he has indicated that he might use it for, it was our indication to the project review committee that it would.
Thank you.
Anyone else? I'll declare the public hearing open at this time. Anyone like to speak for or against, come forward at this time? Seeing none, I declare the public hearing closed. What's the pleasure of the board?
I make a motion to approve the request.
Motion made by Commissioner Morton for approval. Do I hear a second? Seconded by Commissioner McIntyre.
Mr. Chairman, as part of the discussion, I would just like to, again, bring up the idea that as part of our current land use plan, we allow businesses along our major highway. And so I think that's part of the reason why the planning board, brings this forward with a recommendation. Mr. Chairman, I know you're familiar with how highway access is done. I would just continue to encourage us as commissioners to be mighty careful and thoughtful as we allow particular zonings to be put into place and how that may impact our highways. You guys know that several months ago I spoke about trying to make sure that we do keep our highways open. I don't know whether this particular, by the map, it doesn't look like he has access back to Eford Road, which would be mighty helpful, but I just think that we need to be really aware of how many businesses and what businesses that we might put on our major highways. Just a comment. Thank you.
Anyone else? What's the pleasure of the board? All in favor say aye. Motion. All opposed? Motion carried. Got a rezone. Next item.
Thank you, Mr. Chairman. Next case is ZA 14-05. Mr. Jeff Pickett requests a rezoning from RR, which is our rural recreational district, to RA residential agricultural. Property is it's a portion of the it is a 16.86 acre tract. It's a portion of a larger 21.36 acre tract. Tax record number 5269. Property is located on the west side of Gurley Road, approximately 900 feet north of the intersection of Hearn Road. The purpose of this request is to allow livestock and a greenhouse on the property in the RA district. The property surrounding our zoned RA. Property is served by county water, but no public sewer is available. The property is not located in a water supply watershed. A small portion of the property, let's see. It showed the flood zone, yeah. The portion of the property is located on the south side of the property is located in a regulated floodplain. Traffic on this section of Gurley Road has not been studied by NCDOT, but we are estimating about 500 cars per day. Planning board reviewed this request at their last meeting and forwarded it with a favorable recommendation due to the fact that the desired land use is being agricultural in nature, and the property surrounded by agricultural zone property, that the request is in accordance with the land use plan. I'd be glad to answer any questions.
Anyone have any questions?
Just one. Where is this in relation to the gold mine?
This is the gold mine
This is
property.
gold. Thank you. What's up? Thank you.
I declare the public hearing open at this time. Anyone like to speak for or against, come forward. Seeing none, I declare the public hearing closed. What's the pleasure of the board?
Make a motion to accept the recommendation.
Motion made for approval by Commissioner McIntyre. Do I hear a second? Seconded by Commissioner Morton. Any other discussion? Hearing none, all in favor say aye. Motion carried. Next item.
Thank you, Mr. Chairman. Next case is ZA 14-06. Mr. Curtis and Levine Smith request rezoning from NB Neighborhood Business to RA to R20 Single Family Residential. The applicants request to zone 2 parcels of land from Neighborhood Business and RA to R20, as you can see on the map. The property is located on the west side of NC 2427 at Dorothy Road, and it's in the Frog Pond community. The purpose of this request is to allow the property owners to increase the density for the purpose of giving their children portions of the property. As you can see highlighted on the screen with the blue arrow, there's 3 houses on that one piece of property, and they are not able to divide the property unless they're able to get the lot sizes smaller, which the R20 zoning district would allow them to do. Properties on the east side are zoned neighborhood business, as you see in pink, in M1 light industrial, and those are located to the north and south, and are in property to the south is zoned RA, residential agricultural. Property is served by county water but not public sewer. These properties are not located in a regulated floodplain or in the water supply watershed district. Traffic on this section of NC 2427, as studied by NCDOT, is about 12,000 cars per day. Planning Board reviewed this case at the last meeting and are submitting a favorable recommendation due to the fact the property is located in a growth area according to the Stanley County Land Use Plan. I'll be glad to answer any questions.
Anyone have any questions?
What will the driveway or access, will there be access to 2427, that
Yeah.
map that you just had up?
They have, if I'm not mistaken, that has 2 accesses. Don't that road just loop around Dorothy?
Yeah, Dorothy, if you
Yeah,
look on
it
your
just
screen,
looks-
this line right here, this is Dorothy Drive,
It's not
and there's
on right now.
2 residential access
What it
points.
does is, that's one road right there that goes through, you got 2 entrances there. And
Thank you.
there's that's a person's driveway right there in the middle.
Anyone else? I declare the public hearing open at this time. Anyone like to speak for or against, come forward. Seeing none, I declare the public hearing closed. What the pleasure of the board?
Make a motion to approve the request.
Motion made by Commissioner Morton for approval. Do I hear a second? Seconded by Commissioner McIntyre. Any other discussion? Hearing none, all in favor say aye. Motion carried. Next item, item D.
Okay. Before you deny is a request to fill some appointments on the Board of Adjustment. The following members' terms have expired on June 30th, and they have served 2 terms. Todd Swearingen has served as vice chairman and chair for the majority of his time on the board. He's a great member, a exemplary member, and he's willing to serve another term if so appointed. And also Dr. John Ekman III has served on the board also in an explanatory manner and is willing to serve another term if appointed. If you reappoint them, their terms would expire June 30th of 17.
What the pleasure of the board?
Mr. Chairman, I move we approve these 2 appointments.
Motion made for approval by Vice Chairman Donovan. Do I hear a second?
Can we hold a second? Hold off a second on the vote, and have some discussion?
No, you need to have the
Oh,
second
second.
before we do that. Seconded by Commissioner Shudo.
Oh, this is a discussion.
Yes.
Are these 3-year terms? No, the length of term. Each term's 3 years. So they've served their 2, which is what our policy says. And so, should have been reappointed June, July.
We've done it late before.
I know, that's not a problem. Well, we could hold this over to the next meeting, since we've gone this long, if you want to make sure this
Well,
other,
Well, it's here in the board, the planning board has asked for them, so.
well, but it doesn't mean we have to do it. We could hold it over, table it till we've got a motion on the floor, we got to decide.
Do something up or down on it.
I'll withdraw my motion if we're gonna take this up at the next meeting.
Likewise, because I would just make sure we have all the information before we make a decision. You know, I might be wrong on it, but I just thought she had specifically turned it in for.
So this item will be
Divorce.
tabled until the next meeting then. Next item is Health and EMS Department's local preparation for efforts concerning Ebola. Dennis Joyner, Health Director, and Brian Simpson, EMS Director.
Y'all haven't been to Africa lately, have you?
Now, I was getting ready to ask the big question, have any of y'all been to Africa in the last 21 days? It's starting to become a common question. Let me get my... I appreciate the opportunity to be here tonight, commissioners and county staff. I wanted to spend a little bit of time talking about Ebola and the preparations that are going on in Stanley County regarding that. I don't think anything's occupied the media attention quite as much, well, maybe the exception of the election, but other than Ebola. And while we're a small county, a lot of the attention that's been given may make you think that, well, it's going to have to be in a large county, but we found out this weekend that actually Person County had a scare with a potential Ebola case that has been since at least preliminarily ruled out through testing, but that's just north of Raleigh and a bedroom community to Raleigh. So it pays for us in even the little small counties to be prepared, and I wanted to share a little bit about what's going on here, and I've asked for my right-hand support here from EMS, or Emergency Management, which has been doing an excellent job. The big question, as many of you know, is that's being asked now is where folks are traveling from, because if you have been from the West African countries of Sierra Leone, Guinea, or Liberia in the past 21 days, there is the potential that someone could have been exposed to Ebola. Ebola is a hemorrhagic fever disease. It's a very serious disease, and obviously it strikes a lot of fear and concern in people. But it is only spread through touching blood or bodily fluids of a person who's been sick or is sick, touching contaminated objects, needles, those kinds of things. It is not airborne, such as TB. Can't get it through the water or through food. So it is something that's not readily contagious in the general public, but it can be quite contagious for folks who are working with Ebola patients. I share this slide just primarily to point out the number of cases that have been in West African countries. The three that I mentioned earlier, there's been over 13,000 cases, approaching 5,000 deaths. One of the things that's going to have to happen for this, I think, to really be controlled is it's going to have to be controlled at the source in many, many ways. You see at the bottom here, North Carolina has had one state test for Ebola, and that was the one that I was referring to just a little bit ago from Person County. The key players locally are many for us to be prepared for this kind of situation. Obviously, emergency services, communications and 911, Stanley Regional Medical Center, of course, the health department, fire and local law enforcement agencies, and the educational institutions all play key roles in us being prepared locally. Some of the key areas of our initial focus, not just us, but even among EMS, hospitals, and physician practices, is enhanced triage functions to assess travel history and symptoms of patients. So you're going to see more and more questions being asked about where have you been? Have you been in Africa over the last 21 days or the last month? And then start looking into the symptoms of patients. One of the things that is a little bit troubling here, we're coming up on flu season, so many of the flu season related symptoms are going to be very similar. So the key one is going to be this travel question that's out there. One of the next items that we really want to try to focus on is identifying and isolating symptomatic patients, and then maximize appropriate use of PPE or personal protective equipment as indicated. The health department has an EPI team, which is a multidisciplinary team of staff members who meet regularly. We're meeting weekly now to get updates on the Ebola situation from the CDC and the State Division of Public Health. We're monitoring the local preparations, and we're sharing that information that we receive with key stakeholders locally. Information is very fluid, so a lot of things are changing, as you've seen in the news, in terms of the CDC recommendations, in terms of more stringent guidelines than they maybe initially started out with for some of these things. One of the primary health department roles that will occur if, that is going to actually occur is evaluation and management of persons with potential exposure to Ebola. Many of you may have heard that the top 5 airports in North Carolina, in the United States is now being, Homeland Security actually has travelers who are coming from the 3 affected counties or 3 affected countries in Africa are now coming into those airports. They're being further screened. And one of the things that they're also doing now is they're relaying that information to local, to state and local health departments among travelers, so that we can follow up with those travelers once they are in our counties to determine what their risks may be. It may certainly be no risk whatsoever, but this is something that is sort of stepped up the activity that kind of bridges the local involvement with the national involvement. And that really relates to contact tracing. That is where we try to identify folks who would have possibly been in an exposed situation. We do symptom assessment. We also do a risk assessment. And then in this case, there will be active or direct active monitoring for 21 days, meaning that we will check temperatures on those potential exposed folks for 21 days, and then hopefully for all of them, discharge them and from further involvement with us. I think that we've tried to be as diligent as we can in getting folks together that need to have information. We're sharing things left and right. Brian's been very helpful and his staff, and I wanted to let him share some of the things that 911 and emergency management are doing, because they are in many ways the frontline folks for that first interface with a potential Ebola patient.
Good evening. I just want to kind of give you a snapshot of what currently has been implemented and kind of walk you through an actual response in the event. Currently, the Communications Center, we've added specific questionings to their intake process. Now, with the classic signs and symptoms that's currently been recommended by the CDC, it fits varying CAD protocols. So as that telecommunicator starts receiving that information, that's when they inject the travel questions. And it's basically an algorithm it's a yes or no question. If it gets all the way down to yes, which the suspected case is viable, things that most of our medics and most of our folks will begin to truly slow down. We will not, we're coming to help you, but there's a process now that has to be implemented. EMS will be dispatched. No first responders and/or law enforcement will be dispatched unless it's warranted by the call intake. Simply because the initial protective measures is to limit or decrease that amount of exposure, including healthcare workers. So you're going to get you can get an ambulance, you're going to get that duty supervisor, and the reason that these primary folks now, that supervisor is there as a contact monitor, because before those medics can enter that house, they have to don protective equipment. We keep, as all EMS services do, we keep a certain amount of personal protective equipment. But as Dennis just said, this whole situation has been very dynamic, and it has literally changed by the week. So what we traditionally carried, we've had to enhance. Now the recommendation for healthcare workers is no skin exposure. So, we've had to invest in some hood systems. We had the bulk of the material, but a few things we had to get, and then we spent all last week training our folks to appropriately don and doff the equipment. And then once those medics arrive on that scene, a lot of things, a call tree is going to be initiated. A lot of folks have to be notified, not only from the medical side, but, we got to make transport decisions, where we're going to take this person. That notification has to be done very quickly and early, so whatever hospital we're going to, they've got to initiate their own protocols. And then we have to turn our attention to the family members that are in that house. So there's a lot that will unfold. That's kind of where we've been. The Office of Emergency Medical Services out of Raleigh, Dr. Winslow, our state medical director, they put a team together to create basically an Ebola response protocol. Sent out to all the counties. Each county tweaked and added what they felt was very pertinent with advice from our local health department, our local medical direction. And that's kind of what we've built into play, and that's what's currently in place until it changes. And this is a very dynamic situation. And I'm just going to echo what Dennis said. We have to do our due diligence to not only protect our folks that are responding, but to decrease the fear in the public to know that we're coming, we're going to help you. But there's a process involved. So he's kind of explained it all. Operationally, you kind of know what's going to happen. I just want to kind of open it up to questions, because sometimes it's a little easier for us to answer than to share it all.
Dennis, I just have sort of a remark. Don't you think that for us to ever get that in control, we're about to have a vaccine in Africa, because the health care over there and the sanitation is so terrible and so backward. It's going to be a tough one to handle over there, and it's got to be pretty hard to get the more they've got as long as they've had it, and it not spread. You go see where they are getting sick with it. It's terrible. I mean, they're in terrible conditions. Our worst conditions here is a whole lot better than they've got in the best place over there.
No, you're exactly right, and I think that is the fast track right now is vaccine development. I mean, that clearly is going to be one of the biggest steps that needs to be taken. In the meantime, I mean, they certainly have a lot of experience over there in terms of dealing with it, and you've got some county or some countries who have recently they've been 42 days now without any cases. Nigeria recently came off the list. So, they have done a good job in some areas, but you've got some other areas that are so inundated that it's going to get worse before it gets better.
Anyone else?
Mr. Chairman, Brian, you mentioned what hospital they take them to. Is there a designated hospital that we will take them to yet or not?
It's funny that you mentioned that. We actually debated that last week. Originally, it was recommended that for all in our RAC and our regional advisory committee that we would transport to Charlotte. They had the capability to test and treat. Recent recommendations that have come out as of last week was that we transport to our local hospital. And what our plan is that if we have to respond to a potential case, we're going to be on the phone. That supervisor, that's his sole purpose, is to be there for his crews and then start making those transport decisions. And that's going to involve phone calls. You know, we're 30 minutes from Charlotte. So we will be making those calls kind of on scene, on the fly. If it's a critical patient and we need to come here, yes. Yeah. And the hospital here, they've been very proactive. They have been working diligent with their personal protective donning and doffing procedures. So, you know, all the hospitals are ready, but we'll be making those calls on scene.
I think that's the part that I was wondering about, if the local hospitals are, everybody's ready.
They are ready, and we have actually, some of our employees have spent time training their folks. So we're ready, you know, but the ultimate goal is to, you know, and that patient's going to have to be evaluated. You know, what are their signs and symptoms in lieu of what we've now determined. And so we'll be making those decisions on site.
Thank y'all. Anybody else? Thank y'all. Next item is social service request to establish 2 new IMC 2 positions. Tammy Strinkler.
Good evening. I appreciate the opportunity to come and speak with you for this request tonight. I am requesting that we establish 2 additional positions in the income maintenance unit for social services. I provided you some information about the case growth that we've had in Stanley County over the past several years. And actually, since 2007, over the previous 7 years, our cases have increased about 53%. And as you can tell by the information that I presented with you, our increase in staff has not increased at that level. We also have a new computer system that we know has caused some additional challenges. That's our NC Fast system. And we also know that with the healthcare reform changes, we have experienced additional work in our Medicaid department. Actually, the state was proactive in helping us receive some additional funding when they realized the increased time that it was taking to process cases, especially in our Medicaid unit. And we have actually been granted the opportunity to pull down additional revenue. I provided you with quite a few, about almost a year's worth of letters now from the Division of Social Services at the state level, suggesting that we continue to reinvest in our Medicaid program so we will be able to serve the citizens more effectively. So I am requesting 2 additional positions. Now the good news there is it will not cost us any more this year, because we've had an opportunity to look at our additional revenue from what was initially budgeted and know that with the way that we are experiencing our reimbursement, that we will be able to add these 2 positions for the rest of the year with no additional revenue, and projecting for next year that these 2 positions will not cost us any additional county funds due to the increased revenue that we're receiving.
Thank you. Anyone have any questions?
I'd just like to say that if you're not involved with social services, and I do have the pleasure to sit on that board, how hard and how much time the employees went through with NC Fast. Every time they'd think they had something solved, something else would come up, or they'd change something, and it was really a long, drawn-out process, and people working overtime, and you just don't have a lot of time in social services work to drop and do something extra, but they did a commendable job, and I can't say enough about our staff, and I commend Tammy for when she came in, picking right up and making it a lot easier, as easy as she could on all the employees. So I think this is a good thing we can do, and like I said, it won't cost us any money, and hopefully we can continue this later. Thank you, Tammy.
Thank you.
Anyone else? What pleasure, board?
I'd just like to make a motion, sir, to Mr. Chairman, to accept this recommendation for these 2 positions.
Motion made for approval by Commissioner McIntyre. Do I hear a second?
Second.
seconded by Commissioner Ashudo. All in favor, say aye. Motion carried. Thank you, Tammy.
Thank you.
Next item on the agenda is go ahead.
Just for clarification, your motion includes the budget amendment and the position.
I'm sorry, yes, sir.
I just want, okay.
Thank you.
Next item is Utilities Greater Baden Water Sewer District. Presenter is Donna Davis.
Good evening, Mr. Chairman, Commissioners. Thank you for the opportunity to present these three items to you this evening. The first is a project ordinance and two budget amendments to establish project funds for the reconstruction or rehabilitation of the Baton water system, which has actually been broken up into two parts and is funded by two different agencies, one being the USDA Rural Development Office and the second being the North Carolina Department of Environment and Natural Resources State Revolving Fund for drinking water. And I have provided to you all budget amendments prepared by our finance director to create Fund 612 for the Part A project and corresponding budget amendments to 2015-13 and 2015-14. And Fund 613 for the Part B project and the corresponding budget amendment for 2015-15. And I am requesting at this time that I receive approval on the project ordinance and the corresponding budget amendments.
Anyone have any questions, Ms. Davis? What's the pleasure of the board?
I'll make a motion that we approve the project ordinance and corresponding budget amendments. It's been a long time coming. We need to get this done.
Motion made by Commissioner McIntyre for approval. Do I hear a second?
Second.
Seconded by Vice Chairman Donovan.
Mr. Chairman, I have a procedural question.
Go ahead.
And I've been here for a few years, but I'm not sure. Can we handle this as county commissioners, or do we have to handle it as Greater Baden Water and Sewer District?
I believe for the next two items, you need to go into Greater Baden. For this one, you're just setting up a project ordinance from moving money from the general fund to that fund. And so and Jenny, I'll certainly defer to you, but I believe that they can take that action as the county commissioners. But they would certainly need to go into recess this meeting and convene as the Greater Baden Water and Sewer Directors, I believe, to take action on the next two items.
That would be my understanding, since the County Board of Commissioners directs the Finance Department to set up these funds, that it would be the Board of Commissioners that would do that.
Thank you, Lindsay.
All in favor say aye.
Aye.
The next item is we need to recess the regular meeting and go into the Greater Baden Water Sewer District Board. Motion made for approval, for approval by Vice Chairman Donovan and seconded by Commissioner Ashudo. All in favor say aye. Motion carried. Now we're in session for the Greater Baden Water Sewer District.
To the directors of the Greater Baden Water and Sewer District, I'm requesting at this time, first of all, let me stipulate that we have an existing agreement between the county and the Greater Baden Water and Sewer District for the maintenance of the system. USDA has required that we update and provide them with a new agreement, and that one is in excess of 30 years old, and it's probably a good time to do that just for procedural purposes and for updating the agreement itself. So what I'm requesting is that the Board of Directors for the Greater Baden Water and Sewer District authorize myself as the Utilities Director to sign that agreement for the sale of water. In this case, we would be purchasing water from Stanley County Utilities and a maintenance agreement with Stanley County Utilities on behalf of the Greater Baden Water and Sewer District. So this would authorize me to sign the agreement on behalf of the county for the purchase of water and a maintenance agreement with Stanley County for the Greater Baden Water and Sewer District. In just a moment, when we come out, I'll be asking for authorization for the county manager to sign on behalf of the county, And what we're trying to avoid is duplicate signatures on both sides of the same paper.
So I just want to be clear too about this, because this is item 5C that we're handling?
Yes, it
As
is.
the greater business? Greater Baden? Okay. All right. I would move that we approve the authorizing resolution that includes the permission given to our utilities director as Donna described.
Motion made for approval by Vice Chairman Donovan. Do I hear a second? Seconded by Commissioner Morton. All in favor say aye. Aye. Motion carried. I'll entertain a motion to go out of session and reopen the other one.
Second.
Motion made by Commissioner McIntyre, seconded by Commissioner Ashudo. All in favor say aye. We're back in the county commissioner meeting now.
At this time, I'd like to request approval for item number B, which I stated is authorization for the county manager to sign on behalf of the county this agreement for the sale and supply of water to the Greater Baden Water and Sewer District, and a maintenance agreement on behalf of the county that would be entered into with the Greater Baden Water and Sewer District.
Anyone have any questions? Hearing none, what's the pleasure of the board?
Move that we authorize.
Motion made by Vice Chairman Donovan for approval, seconded by Commissioner Ashudo. All in favor say aye. Motion carried.
Thank you.
Next item is the Stanley County Fiber Build RFP. Presenter is Andy Lucas.
Thank you, Mr. Chairman, members of the board. At the board's most recent recess meeting on October 13th, the board heard an update regarding a fiber study and assessment that we've been working on in partnership with the EDC. With the change of some things, we were primarily focused on our economic development sites, but with the new emergency towers going up and the opportunity to connect those with redundancy, we began looking more closely at a fiber loop that would connect to the MCNC, the open access fiber, which would bring in enhanced fiber into Stanley County, which could then assist with economic development, but also with our radio system. And so at that time, the board directed staff to work to get an RFP developed to generate some more specific cost estimates for the construction of that 45-mile fiber loop. And so what you have before you this evening is that cost estimate. Just to do the cost estimate for to administer the RFP, develop the RFP and administer it from ECC, who is our existing consultant on this project. The fiber loop, to actually engineer it and design it and put it out to bid would have been about $150,000. And so what they're saying is, don't take the time to do that while we're still looking at potential funding partners and looking at even having some conversations with the Union Power Cooperative about maybe some relationship there or some partnership there. No sense in designing it and then having it change because of stipulations from funding partners. What we can do is get an RFP out on the street for cost estimates per foot, both aerial and buried, and that'll give us a better idea of the cost. And so once we have that, then we can nail down this board or a future board could finalize any other funding arrangements that may be available, and then potentially proceed with this project, which would bring open access fiber across that, connecting our emergency communications network, but then also open that up to others that may want it for economic development purposes. And that fiber is the key to the whole system, whether it be our radio microwaves for our tower or any wireless providers that would want to come in. That fiber backhaul is really the strength of any kind of broadband system. So this contract this evening is to allow ECC to help develop and administer that RFP for those cost estimates. And also there's a budget amendment for your consideration, since this would be additional funding that was above and beyond what was developed in the Economic Development Strategy Fund as of July 1st of this year. I'll be happy to answer any questions.
Anyone have any questions?
Mr. Chairman, I have a question, but I would comment, we have two members of the EDC board here tonight, Bill Lawhon, Scott Eford, and also our EDC director, and of course you were at the last meeting as well. They didn't take this item up as an item, but the discussion was very clear, I felt like, from the board members that this open access fiber is critical to economic development within Stanley County. And I'm glad to see that this item is before us tonight, and I hope we can continue to move it forward.
Anyone else? What's the pleasure of the board?
Mr. Chairman, I'd make a motion that we consider authorizing staff to enter into a contract with ECC Technologies and that we amend the EDC budget to cover the cost of this RFP development.
Motion made by Vice Chairman Donovan for approval. Do I hear a second? Seconded by Commissioner Ashudo. All in favor say aye.
Aye.
Motion carried. Next item is Stanley County Building Reuse Grant Resolution. Presenter is Paul Stratosphere.
Thank you, Mr. Chairman, Commissioners. We've been working with a company that has been looking at an existing building in Stanley County in Albemarle that has been sitting vacant for some time, and they're looking at that building as a potential additional manufacturing site. And as part of our efforts to help them and move this project forward, we are asking for your support in supporting a building reuse grant from the North Carolina Department of Commerce. And as part of the building reuse program, there is a 5% match required by the county. And so the 5% based on the preliminary numbers that were generated through the pre-application process for the renovation came to $476,500, and half of that, it's a matching grant, so half of that would be paid for by the grant, and 5% of that comes to approximately $12,000. I ask for the board's support of
anyone have any questions? What's the pleasure of the board?
Mr. Chair, I would move that we approve the resolution to support the building reuse and that we appropriate the financial match.
Motion made by Vice Chairman Donovan, seconded by Commissioner McIntyre for approval. All in favor say aye. Motion carried. Thank you, Paul. Next item is Personnel Resolution Travel Policy Amendment. Presenter is Andy Lucas, County Manager.
Thank you, Mr. Chairman, members of the board. I'd like the board's consideration to change our travel policy, our current travel and assistance policy, which would limit meal reimbursement for travel and training to the established per diem rates. As you can see from the previous policy, folks could actually turn in receipts and they would get more than that. It was very unlikely that someone would turn in receipts if it was less than that, because they could just go with the per diem. And so one of the reasons for this is just to streamline our process. Finance is trying to do everything paperless as much as we can, and so having to keep up with all these receipts is somewhat cumbersome, both for the department and for finance. So that's part of the reason. And two is just to simply, in somewhat of a respect, as a financial control mechanism. The established per diem rates were put there based on the average cost for breakfast, lunch, and dinner. And so I'm asking for your consideration to amend this policy effective January 1st, 2015.
Anyone have any questions?
Make a motion to approve.
Motion made by Commissioner McIntyre for approval. Do I hear a second? Seconded by Commissioner Morton. All in favor say aye.
Aye.
Motion carried. Next item is the consent agenda, and I'll entertain a motion that we approve the consent agenda as presented.
So moved.
Motion made by Commissioner Ashudo for approval. Do I hear a second? Seconded by Commissioner Morton. All in favor say aye. Motion carried. Next item is public comment. I don't see anybody y'all want to come down and talk to us, don't believe so. I'm gonna start down here with Commissioner McIntyre.
No comment. Just remind everybody that tomorrow's voting day.
I'm glad you reminded me of that. But I've already voted. So.
You ain't voted.
Commissioner Morton,
No comment, sir.
Commissioner Donovan,
No
Vice
comment.
Chairman, Commissioner Shudo.
Yeah, just real quick, just want to report on the town meetings I had over the last couple of weeks, or I guess last 2 or 3 weeks, and they went pretty well. We had, the lowest attended was Richfield. We had like 6 people there. Then I think the highest was 16, maybe 15 or 16 out in Locust. And it was pretty good discussions. One of the big things that came across with it is up in I did the one in Richfield. Those folks here up there would really like to have a sidewalk that connects Pfeiffer down to Richfield, and that's something maybe we could look at in the future. Try to get help from the state or government on that, because that would be a, I guess the students walk down on the railroad tracks and stuff to get down there, and it's not that far. I think there's it's a half-mile stretch of sidewalk that they would want. The discussion down in, I know South Stanley was concerned about the schools. There's a big discussion about the schools and what to do about them, whether to fix them, especially trying to fix up some of the ones that were older. And in Baden, they talked about Ebola. They asked about if we had any plans in place if that happened here. So that answered the question tonight. But it was pretty good. It was pretty good. I mean, a lot of it was about the tax, the sales tax. And I found that a lot of people were kind of skeptical about the proposed sales tax referendum until you explained it. Once you explained it, then they're like, oh, that's fine. So hopefully we explained it to enough people for tomorrow. And there were a few other things, but I'll just save that for another time.
I have no comment. Manager?
No comment, sir. Thank you.
Mr. Attorney?
No comment, sir. Thank you.
Well, at this time, I will entertain a motion to go into closed session. Motion made by Commissioner McIntyre to go into closed session. Do I hear a second? Seconded by Vice Chairman Donovan. All in favor say aye. Aye. We're in closed session. Excuse me, that's real estate. GS 143-318.11 little a parentheses 5 parentheses. Now.